Well, the Omicron surge could be reaching a peak in some cities, with daily infections slowing down. But for hospitals, things could get worse with more COVID-infected patients seeking care. Treatments for non-COVID related issues are getting postponed in many places. God Venegas reports.
Omicron impacting millions of Americans, and hospitals across the country in dire mode, bracing for the demand of more patients. Staffing shortages are a challenge as healthcare workers fight the virus themselves. In California, ambulances are facing long delays and some scheduled surgeries are being postponed. In Oregon, hundreds of procedures are on hold.
You know, in a way, it's not an elective surgery because my life is not my life anymore.
Massachusetts General Hospital System will postpone more than 2,000 surgeries each week, bracing for an influx of patients.
We've got patients being treated in hallways. We've got patients being treated in chairs in the waiting room. Last week, we had to shut down a part of our emergency department because we just didn't have the nursing staff to staff it.
But there's some light at the end of the tunnel. Cities like Chicago, Washington, D.C., and New York seen hospitalizations plateau and some dips in the number of daily cases.
Overall, the prognosis, the forecast for COVID is much brighter than it had been before, and that is very positive news.
And starting this weekend, if you have insurance, you can purchase up to 8 at-home COVID tests a month, and your insurance provider will cover most or all of the cost. Check that you're purchasing from an in-network provider. If not, they'll only reimburse up to $12 a test. And save those receipts. You have to file for reimbursement by filling out a form such as this. And this Wednesday, a federal government website goes live. Families can order up to 4 tests per household, and they'll ship in 7 to 12 days.
We have 1 billion tests that will become available to people that they can order through the website.
Yet for many, it will be too little, too late, as the spread of Omicron continues.
And here in Indiana, only 9.2% of ICU beds are available at hospitals statewide, and 37.9% are being used right now to treat COVID patients. But some good news, 63.8% of our state's ventilator supply is still available. So today we'll get another update on the COVID fight here in Indiana. But as of Thursday, more than almost 1.5 million Hoosiers have tested positive, and that included more than 33,000 cases of reinfection. And so far, more than 19,000 people have died. Well, COVID-19 infections are rising again at U.S. nursing home. Deaths are climbing too. In some areas, that's leading to visitor restrictions and a push to get more residents and staff members boosted. Health experts say Omicron, that highly contagious variant, is to blame. Last week, nursing homes reported 645 COVID-related deaths, along with 32,000 COVID cases, 7 times what they had a month ago. Well, for many, this school year is proving to be just as stressful as last, with some districts going remote or canceling classes altogether. But some school systems have managed to navigate this latest surge and are even planning for the next one.
We have to start thinking of COVID as a constant.
It's an unsettling thought, but a strategic planner says school districts need to face the harsh reality, and the time is now to start making plans for what could come next, like a mixture of in-person and remote learning, an iPad for every student, and staff focused on emotional support for students.
We've got to figure out how we respond to problems that we don't even know about yet.
Under federal relief bills, Congress allocated $190 billion for schools to respond to the pandemic. The Department of Education says much of that money has gone towards school climate systems and hiring mental health professionals.